Hello, welcome. Today I'm going to be working on the lovely Ashley. We're going to be doing an upper back and shoulder massage. Let's go ahead and get started. If you don't have time to watch this video right now, go ahead and save to your watch later and just watch whenever you get a chance. So always with full back, I like to just do something that's a little more grounding. I'm going to do a nice stretch for the whole spine. And I'm just going to put some pressure on that sacrum. I'm not pressing down as much as I'm pressing away, just tilting that pelvis a little bit. If you kind of feel like you're a little slidey, don't worry too much about it. And just replace your hand. I like to hold this for a good 20 seconds if I can. And I'm going to land on that glute medius. I'm just stretching from side to side, putting my left hand on Ashley's shoulder, my right hand on her glute medius. Really encouraging these hips to relax. And honestly, that angle of my wrist isn't great. You can always just change the angle. Your wrist is a little happier. And I will typically like to work on this glute medius a little bit before moving into the back. Including a little bit of gentle rocking is really great for the lymphatic system, and it's a great distraction technique. Find that this can help the hip joints feel like they can relax a little more too. And just offering some compressive work as I walk my hand up the back along the spine. Working on these erector spinae. Just tracing that shoulder bone. I find that the most natural position for me to do that compressive type work around the scapula is just with my forearm. So I'm actually going to land on this erector spinae. There's something that can feel really soothing about this really broad surface area. Pressing along these mid-back muscles. It's going to be difficult to do anything that is super deep working with such a large area, which is good. At least for now. I'm just going to start to focus on the lower, mid, and upper trap. Following that kite-like position on the lower trap. Just keep in mind that because I haven't put any oil on Ashley's back yet, I have a really nice place to just grab hold of that muscle tissue without sliding off. And it's just great if you want to do a little more compressive work without going super deep. You can actually work with a good bit of detail. And you'll pretty immediately find trigger points in here, areas that need some attention. You're not going to get the same ease of grabbing hold of that muscle tissue when you have oil. I would typically be doing this when someone is draped, so a sheet over them, and it actually is a great way to do this compressive work as well. So there's a big difference between just poking around and actually, bringing mindfulness into what you're doing and finesse. This can begin to feel a little repetitive if you do it for too long. So I'm going to go ahead and grab my oil. And if you know right away that you got too much oil, you can just put some on your forearms. And as I disperse my oil, my effleurage is going to become a lot more flowy. So this effleurage technique isn't really so much down and up, it's following the rector spinae, crossing over that iliac crest, and really grabbing hold of those lats on the way up, and hitting those upper traps on the way back up as well. Sometimes I'll just do some shorter strokes along the rhomboids. And if I'm picking up on a little bit of ticklishness, just be mindful of how I'm working on those erector spinae. Usually being firmer helps if someone's ticklish rather than working more lightly. It can feel really lovely to pause just before that hip bone, kind of linger along that band of really thick connective tissue that rests along the hip. And Sometimes I'll just do a few passes with my forearms and elbows just to get more into a flow. So it's going to take a little more finesse to find your flow with your forearm on a smaller framed person, because you're naturally just working with a bigger tool and you have less surface area. I really enjoy using this forearm technique if I want to focus on that area around the hips a little bit more. And it's really great for the lats as well. Sometimes the transitions down the back and back up can feel a little awkward when you're just learning how to use the forearms more. Just getting creative and finding techniques that make sense and tie everything together. Can be really healthy to stretch these 3 erector spinae muscles away from the spine, just creating a little bit more space. This is one technique that can trigger that ticklish feeling if you're not careful. And just working my way back up these erector spinae. And I'll often do at least a couple passes doing that same routine down the back. Find that with repetition, the back muscles are able to really more deeply relax, even if you're not using super deep tissue. And if you're kind of getting up towards this upper trap and you feel like you're already picking up on a lot of congestion and rounded shoulders, then you can always kind of adjust the arm. So sometimes I like to just open up that scapula a little bit and pull the shoulder down. Just open everything up a little bit more. Anytime that you do any sort of pulling on the arm, though, you want to make sure that the elbow is bent and you're not taxing the joints at all, obviously. I'm just working my way around the scapula. Sometimes I find that it's almost more effort to try and do light to medium pressure with my elbow instead of just going right in with my thumb. You have so much sensitivity in your finger pads, and you're not going to be overtaxing your joint as much because you're not pressing as hard. So once you kind of know where the trigger points are, you can decide what technique you want to use. I don't usually use my thumbs on people that want deep tissue because it's just not good for the thumb joints. There's other really great techniques that are just as effective. For some reason, sometimes people that could use slightly deeper work tolerate thumb work better than elbow. It's really normal to feel that crunchy sensation, just those adhesions that are thick and sticky. I try to avoid that sensation as much as I can. I like to just do as much compressive work as I can, nice and slow, to really just melt away that tension instead of forcing anything. And I like to do a nice proper cool down whenever I do that trigger point work. I'm just gonna work on these lats a little bit, make nice with that upper trap. You can even use the heel of your hand to get into that connective tissue around the hips a little bit more. And some long, slow effleurage strokes to finish. If you're overly tentative on your way up, you're going to feel really out of flow. So you do need a firmer pressure on the way down and really grabbing hold of those lats and sinking into those upper traps on your way back up. And one last effleurage stroke to finish. And that is all for today. You're welcome. Thank you for joining me today. If you enjoyed today's video, you should check out our Patreon page where you'll find some really great exclusive content. I look forward to seeing you there.